Hi guys, wanted to address a couple of questions that popped up over the course of the last months. So we did the liposuction for lipedema for the lady for the arms, and she had the swelling of the hands. And a lot of people are concerned about that. So when we do liposuction of the arms, we do liposuction of the shoulder, of the armpit, of the arms circumferentially, including the forearms going down. The reason we do it, as you probably know, is because we're trying to avoid what I call Count Popeye syndrome, where you have shoulder pads later on and then swelling or increased amount of lipedema in the forearms. So when we do that, we have to put a compression on the arms, forearms, all the way down to the wrist and the shoulders. There are several styles of garments that we recommend. Originally, we're recommending bolero style, where you have the garment go up to here with a connection on the back. But what we find is in the armpits, it's usually very raw and very uncomfortable. And several patients mentioned that it's very difficult to manage. So now we're switching to marena garment, where you have more of a vest look, and it goes all the way down to the wrist, and it's much easier to pad the armpit, okay? The question is, why does the hand swell up? And the reasons this hand swell up, because the swelling goes along all upper extremity, and when you have a compression at the wrist and nothing is compressing the hand will swell up. There you have two options. One option is to wear the compressive gloves. On the website, you'll have a link for the open finger compression gloves, or you can speak to one of the lymphedema specialists and order a custom glove. The other option is to loosen up the wrist. And sometimes it's possible, sometimes it's not. If you wear compression wraps, you can loosen them up. If you're wearing ACE wraps immediately after the surgery, you can also loosen them up. But if you have one of those garments, it's hard to do. So you can just cut a portion of the garment and it will allow the swelling to reduce. What happens is that after the surgery and the swelling increases, it'll sort of like choke off the blood supply here a little bit. And then once the swelling goes down, it'll get better. The swelling goes up for about 3 days, and after that it goes down. So usually people see the hand swelling for about 3 days, 4 days, and then it starts also going down. But sometimes it could be worrisome, all right? Another question I want to address is, can you have a swelling of the legs after liposuction of the arms? And the answer is yes. I know it doesn't make sense, but it does. What happens is this: you have chronic inflammation in your legs as a result of lipedema. Okay, you have the surgery, and the surgery is on the arms. The body has overall inflammation. You have a lot of fluid going in and out. And there's a concept called third spacing, where the fluid goes into the most inflamed areas of the body, causing the swelling. So if we do liposuction of the arms, the swelling is going to be in the arms. But because patients with lipedema also have chronic inflammation in the legs, it is not uncommon to legs to swell up a little bit more. Again, not as if you had the surgery on the legs, but also still have some swelling of the legs that will eventually get better. And that's why it's very important to continue to wear compression of the legs, even though you had the surgery on the arms, all right?